2, 1. What is up, Travelheads? I'm your host, Brian from Life of BD, and I welcome you to Talk with BD. Today's guest is a New York registered nurse who is currently working firsthand with COVID-19 patients. Today we are going to talk about the craziness in New York City during the coronavirus, life as a nurse during the time, especially in New York. So without further ado, Kristian.
Hello everybody. My name is Kristian. I am 22 years old. I am a registered nurse here in New York City. Actually, a new registered nurse. I graduated nursing school May of 2019, so almost a year ago. And I took the boards around the end of July of 2019, and I was licensed August 2019. And here I am in the middle of the craziness, as you said.
Crazy time. Thanks for getting on. You have a busy schedule going on with nursing and stuff, and yeah, it's like to have you on. I appreciate it. Tell us a little bit about yourself. I know you just did tell us a brief intro about yourself, but if there are any more to talk about you.
I was born in the Philippines, but I came here when I was 6 years old, so that was in 2003. Basically, New York was my whole life, and I went to school here, I made my friends here, and I grew up personally loving the arts. I actually was gonna go to college either for the art or biochem for pre-med. Actually applied to theater and biochem for college, but they mixed up my application with someone who was doing nursing, and I decided to go along with it.
It looks like it worked out perfectly fine for you.
Times are crazy right now, but it's very fulfilling and rewarding with what's the service that's going on, so I don't regret it one bit.
So you were born from the Philippines. Talk about the Philippines. I had plans to go there in the end of May to the whole June, but with the lockdown happening, that's not happening anymore, sadly. But you've been a registered nurse for only 6 months now, and your job had nothing to do with COVID-19 in the beginning. I don't think no one really had anything to do with COVID-19, but with a sudden change due to COVID-19, when did you have to start doing the coronavirus patients, like deal with them?
Yeah, so my floor was originally a cardiac surgery step-down floor. So we take care of patients who just got off open heart surgeries, and even those who needed like ablative heart procedures or electrophysiology procedures, and we take care of those patients. Basically, the patients who come from the cardiac ICU, and if they're well enough, then they could go home. The transition to COVID 2019 floor happened around, I believe, the first week of March. So our floor was converted into a half floor. It's a COVID 2019 tele floor. So just COVID patients who just need to be in monitor. And the other half is COVID 2019 ICU patients. So mostly those who are on ventilators, on drip, so really the critical care patients. But the whole floor was turned into a COVID floor. So everyone in our floor is COVID 2019 positive and very sick.
I can't imagine the chaos you had to go through, putting yourself in the line of fire, especially when you're still new to this in a way. I mean, how did you feel at the time?
Well, around the end of February and around mid-February, we were hearing reports, of course, of COVID 2019 going around in the world. We didn't really expect that it would come so quickly to New York City, especially to our hospital. I believe the first night our floor was converted, there were only 4 nurses on the floor, and usually there's supposed to be 9. Either some people retired already because of the news of COVID, or some of the nurses were already sick, or the truth is some nurses, of course, have their own families or have babies or are pregnant and are not willing to go to work for medical and personal reasons. I was called in actually at 8:30 that night to come into work because they were so short-staffed, and usually shift starts at 7 o'clock. So I ran and went to the hospital, and that very first night, I think it was the most hectic and craziest night ever. Of course, everyone, even the manager, all the nurses, and all the hospital teams, even the doctors, the techs, and everyone else. Of course, we didn't know what to expect. the CDC, their policies and their recommendations for the virus were still oscillating. It's still not really definite, and we're just knowing more about the virus each day. It was very thick. No one really knew what to do. Of course, everyone was scared of contracting the virus and exposing ourselves. We weren't sure if the protective measures we're using were enough or whatnot. So it was very, very crazy. I remember in the middle of the shift, I went inside the supply room by myself because I was like, what the heck is going on? I don't know what's going on right now. But it's very nice to have such a supportive team to work with you amidst the crisis.
Does your parents know you're dealing with COVID-19 patients? And if they did, like, what were the initial thoughts of it?
Yeah, so I actually am with my mom, and my mom has been a nurse for 30 years. She works in the PACU unit. It's the post-anesthesia unit. So it's like a recovery room. And her floor was also transitioned into a 100% COVID floor. I mean, the truth is, almost all the hospitals here in New York have transitioned into COVID floors 100%. So, of course, my mom just reminded me on being safe and the things that I should do, should not do to maintain safety, especially when it comes to contracting the virus. She can't really tell me not to work, of course, because she's in the same situation. So actually, when I get home, it's more of like a running joke between me and her. I was like, oh, who's infected first? Is it you or is it me? But it's also comes with the support from her as well, and I wish her safety and health as well in crisis.
But did she really want you to deal with it? Like, she knew she had no other choice, but what did she feel like?
Well, she always tells me, and even all of the nurses in the floor always tells me, this is the worst time to become a new nurse. Literally the worst time. It's literally a warfare in the hospital. And every COVID floor, every COVID facility, actually, I'm just taking it in a positive note, even though the whole crisis is not positive at all, that it's a learning experience. Even seasoned nurses have been telling me that it's a experience for them too. Even nurses who've been on the floor for 30 or 40 years said they've never expected to go through a pandemic like this. And it's a learning process for everyone, and it's definitely a learning process for me too. I am not an ICU nurse, we're a step down floor, so it's a grade lighter than the critical care. But because of the COVID and because our floor was transitioned into a COVID ICU floor, I'm getting to get hands-on experience with ventilators and sedation drips or whatnot. So my mom is telling me to just take it as an experience, and it definitely will help the resume, knowing that you get hands-on experience with something so traumatic and so critical like COVID.
At your age too, at age 22, dealing with COVID already, like that resume is like, you've been through all the pressure and stuff, and now it's like, after COVID's over, you just gotta think about everything's gonna be easier because you went through a lot already. So it's like everything's gonna be like not as hard as it was.
Well, that's the hope. But honestly, even after this COVID ends, the question is, does it really have an end? I feel like this is the new normal, and I think things will be like this for quite some time. So that's something getting used to for sure.
New York is what you can say is the epicenter city. New York City is the epicenter city of the coronavirus. What are your thoughts on that?
I don't doubt that at all, especially because New York is so dense. I know millions of people are living in New York, and aside from the people living in New York, we have tourists all the time. People of course want to see the Statue of Liberty or Times Square or their Broadway shows or whatnot. Especially at the rise of COVID, when COVID was just starting out course, we have tourists here from all over the world. We don't know if those people came from level 3 areas where the COVID virus was already very dense and was already permeating across people and communities. So I do not doubt it at all. And New Yorkers have the tendency to become or be not really compliant to some policies and procedures. So, and I am a first-hand witness of that, even though we do have policies of lockdown and social distancing. I still do see crowds of people unmasked in the streets, in the parks, in the benches, running, laying down, doing their usual jogs, except nothing is really happening. So I do not doubt it at all. And if there is a second wave to happen, I will not be surprised whatsoever, sadly.
Yeah, same here. I'm pretty sure there is gonna be a second wave coming soon. But yeah, just I live in California, and just across the bridge from San Francisco and Oakland. So I'm pretty much in a busy city also. And yeah, you just see people out there and stuff, no mask, no gloves, nothing. And I'm just like, sheesh, man. It's like you guys are an issue right now.
Yeah,
but,
and I heard also, I think the other day it was so hot in Cali that was it Newport Beach that was flooded with people. See things,
all the beach.
See things like that really perpetuate the virus, and it's sad to say, it's also all driven by, I think, a lack of belief in the virus itself, which is really, really sad.
Yeah, and that's what causes the virus to spread, because it's like you're not doing what you should be doing. It's like until you have it, then you're gonna be in regrets, but that's a bit too late. But yeah, it's scary because in Alameda Beach, I heard there was a lot of people there, which is just a city away from me. And I'm just staying in my backyard in this 85-degree heat, but I'm like, oh, whatever. I mean, I gotta do my part because I want to go back and travel. And we all just gotta do our part, to help the world. It's a global situation. It's not a city or a state. But yeah, what city do you live in?
I live in Brooklyn, actually. Brooklyn is quite big and vast. I'm more closer to Manhattan side. If I take the train, I'm in the city in around 15 to 20 minutes. So it's not too far. I do work in the city in Manhattan. My hospital is in the Upper West Side. So it does take a while for me. It does take me an hour to get to work. But being the city in general, it takes me around 15 to 20 minutes away from where I live in Brooklyn.
So how cautious were you with taking the subway, like the safety and everything during this time while you're heading to work?
Yeah, so the subway is a very tricky issue. I really don't have a choice but to take the subway to go to work. Some people lift their Uber because they are wary of taking the subway, but that will cost me a bank if I take Uber or Lyft every single day. So, the subway is really the easiest way to get to work. I don't drive at all. Personally, I don't find the need to drive in New York City, given that we do have the subways. But I have been trying to be careful as much as possible, both health-wise and safety-wise. Health-wise, we have homeless people who stay in the subway, who lay down the subway because they have no place to stay. So they have no choice but to go in a place where they can be protected from rain or from the cold. Especially it's not summer here yet. It can get very cold or chilly still, so that's where they stay. Of course, I wear my mask all the time, especially the subways can get really, really crowded still. I get it. We have, frontliners, essential workers who are just not in the healthcare field. We have grocery workers, and we have other delivery personnel that need to go to work, and people who cannot afford not to go to work. So we have that. So social distancing is quite hard in the subway. So I wear my mask all the time. I try not to hold on to the rails as much as possible, especially because the virus can stay on surfaces for hours to days. But other than the health concern, I think safety is another issue when it comes to the subway, especially with those in the recent weeks of both targets against Asians in public places, as well as
Yes.
people in the healthcare industry. There have been reports the past weeks of people wearing scrubs in public places, getting targeted violence. We have I believe, a nurse a few days ago who was thrown bleach because she was wearing scrubs in public place. And we've heard reports of Asian Americans who've been subjects of, violence and attacks the past weeks. The rise
Yeah.
of, the varying perspectives about the coronavirus. I believe there was one incident a few weeks ago. I was drinking water in the subway, and I choked on the water, and I started to cough. Everyone looked at me and backed away, probably because
Oh
one, I was
no.
in scrubs, and two, I was Asian, and I had to say, guys, I just literally
Yeah.
choked on the water. I do not have the virus. So, and it's not just the subway, honestly. It's all
Huh.
around public places. It's been quite hard in the sense that you do get a little afraid um, going out in public places because of all the hates and all of all of the misinformation spread by media and by certain figures because the coronavirus.
How's the process at work now? I'm pretty sure it's like different from when you first started, especially with COVID-19. Like you're not just clocking in and going straight to work. Is there like any safety procedures you have to go through like the moment you step foot into the hospital?
Mhm. Yeah, when we were still a cardiac floor, you go straight to work, get report from the AM nurses or the shift priors nurses about your patients that you're assigned to, and that was it. You start your shift until you end your shift. But with the whole COVID 2019 situation, it takes a longer time before you actually get to see and assess your patients after report because the report itself takes long. So of course you get to your unit and then we don our PPE, our protective equipment. So now we have to get our N95 masks, our face shields, our gowns, and the reports for the patients this time are very, very, very long. So when we were a cardiac unit, most of the reports for the patients are just their diagnoses, or if they had surgery, what their surgery was, why they needed the surgery, their past medical history, how they are system wise, like how they are neuro, their cardiac, their respiratory, if they're peeing, if they're pooping, if they have any IV lines, what's the plan for them by the doctors, is there any special contact information, and that was it. No, and then you go and see your patient. But now with this COVID, the report
Mhm.
is really long because the COVID 2019 ICU unit deals with ventilators and drips for sedation and paralytics for the ventilated patients. You got to talk about the settings of the ventilators, on what percentage of oxygen they are, what rate their respirations are set, their lab results, for example, their arterial blood gases, which tells really a lot about the patient's oxygenation status and their whole system status. If we're pending any code, if we're pending any cardiac arrests or whatnot. And other than the vent settings, we gotta talk about the drips, what rates they are on. So it takes really, really long. I could say before reports for per patient goes between around, let's say 5 minutes max. But now per patient, we spend around 15 to even to 20 minutes talking about these patients. Because of course, we want to have a comprehensive idea about how the patient is doing, how the patients are doing, especially with COVID, which really puts them at a very, very critical state, sad to say.
There was a lot in that, I could be honest with you, that I did not understand because I don't know much about this, but I'm like trying to take it all in and trying to picture, but I'm like, I can't really, but yeah, okay. So many hospitals have shortage in equipment like masks and all these other safety equipments. Like, how are you guys in your hospital? How are you guys dealing with this
I think
issue?
protective equipment nationwide is very scarce. If not scarce, I know some hospitals don't have any at all. It was in the news actually a month or so ago, where a hospital branch was using black plastic garbage bags as their gowns because they had no protective gowns. And that is true for a lot of places actually. And it's not just about the funding of the hospital, but it's just a general fact that the virus swept the country by a storm and we were underprepared. That is the truth of the matter. So when they say PPE is not enough, it is true. We actually use the same N95 masks. We try to use it for several days, to be honest. So what we do is we have the N95 mask and then we put a surgical mask on top of it just to prolong the life course of the mask. We use the same face shield if we're like working straight in a row, straight days in a row. We would reuse those face shields because we generally do not have enough. And there are times when we don't have enough gowns and we gotta get it from another floor or another place, which is very, very unsafe, especially because if a patient in your room, let's say, is losing oxygen or they took off their oxygen device and you gotta run into the room, the dilemma comes in, are you gonna run in the room without the gown on because you have no gown at that specific moment? So that's where it can get really tricky when it comes to lack or maybe scarcity of protective equipment.
Is there a way you guys could disinfect the mask, if anything?
When it comes to disinfection of masks, it is possible depending on which mask you have. For example, surgical masks, they're good at filtration, but they're also soiled very easily. So what happens is I get rid of the surgical mask right after the shift. And if it's really soiled, you gotta get rid of it right away because it diminishes its effectivity in filtrating any particles that's going through. Most people, I heard that they try to wipe down their masks with disinfectants or wipes, which may help, but in the long run, it also decreases the effectivity and filtration of the mask because it does get wet. So layers of the mask can, get rid of. But there are cloth masks that some people use which are not that effective in filtration, but people put it on top of their mask, and people, of course, outside in the public can wear cloth masks, and just washing it in the laundry or in the washing machine is actually sufficient enough to clean cloth masks.
Okay, yeah, that makes a lot of sense actually. For the N95 mask, I know that there are there's a lot of different type of N95 masks, and I believe there are some that doesn't actually work for like COVID-19.
Well,
Is that
N95
true?
masks, like everything else, there's different brands of it and there's different types and structures. But generally, the premise and the hope for N95 masks and the use for it is basically the same. So there's different types of respiratory particles depending on their size. There's ones who are bigger, like 5 to 10 micrometers. And N95 is sufficient enough for that. Even some surgical masks as well, because they're big enough to not go through some spaces like in a surgical mask. But for airborne particles, like very tiny particles that's less than 5 micrometers, that's where an N95 really is needed. So an N95, the premise of it is that it's so tight on your skin, unlike a surgical mask, that the hope is that it filters even the smallest particles. So there are different brands, there are different designs and structures of N95 masks, but the premise of it is the same. But the thing that most people don't know actually, that N95 is individualized per size. From what I know, there's a small and a regular size, and you have to be fit tested for an N95 mask. Basically, they put like a hood over your head and you put the mask on. They will spray some bitter tasting spray in that hood, and they determine your size, your appropriate individual size of the N95 mask depending on that fit test. So I see people in the subway, in public places, wearing N95 masks thinking that it's helping them, when actually it looks too big or too small on them. That is not helpful whatsoever. And the truth is, if it's too big for you, if it's too small for you, it's actually defeating the purpose. So N95 masks are usually reserved for people in the direct care of COVID patients, just because we are more closely exposed to COVID patients, and we are fit tested.
Wow, that's pretty crazy, because I'm pretty sure 99% of the people in the public, including myself, have not really actually tried to fit for the mask. So that's scary, you know, to see like everyone walking by you and you think that they're taking their safety precautions. So then it's like you're doing your social distance, but you're not as worried. But really, most of us have never test our size, and
that's why the CDC recommends, like for the general public, that even the cloth mask is just fine, either by cotton or even bandanas, they're saying. Of course, it doesn't feel or seem as safe as a surgical mask or N95 mask. But of course, you know, everyone wants to take their precautions and their safety, so I can't really blame anybody. And initially, the CDC discouraged the general public from wearing surgical masks or N95 masks, just for the sake of, you know, frontliners, healthcare workers, to not be in lack of those equipments. But you know, you gotta do what you gotta do to protect yourself, I say.
So you're saying that regular people, the ones that are in the public that aren't working for any of these fields, they should just have the cloths and stuff, clothing to put over their mask, over their face, while save all the N95 and the surgical mask for the people that are on the field.
Well, that is the especially because we are again very direct care of COVID patients. I mean, most of the time my face is right in front of a COVID patient, especially the very confused patients who take off their mask. I gotta put their mask back on so they get their oxygen back, and I am literally thin hair away from their face. So that is the time where an N95 is really useful, and if we are really scarce at it, then I am exposing myself, healthcare workers are exposing themselves. But I know people have their own set of surgical masks and N95 masks, which I understand. My main concern is that their N95 masks might not be the right size for them. It's actually doing more harm than good for them in their venture for their health precautions.
Maybe just putting on a cloth over my face would be better, because you don't really have to size it up and stuff, and you just wrap it around your head. So that would be preferable for like 99% of people that aren't really like test fitting their N95 mask. Is that what you're saying?
Yeah, well, since there are generally two sizes of N95s, a small and a regular, people can kind of tell what their size are. Usually if they have bigger face structures, then a regular would probably be the right fit for them. But again, it all boils down to the fact that there are people and workers who do need these N95 masks. And even just in the general public, in the general space, a cloth mask is sufficient, or a surgical mask itself, because they are not really in direct exposure to critical COVID patients like we are in the hospital, especially those different oxygen machines that aerosolize the virus in the air. So it's not really like that, let's say outside in the park. but it is still important to have some sort of covering, especially for the nose and the mouth where the virus can really enter. So yes, a cloth mask is sufficient according to CDC. If you have a surgical mask, that's also really, really, really great. Oh, I'm not saying that no one should wear surgical masks or N95 masks in public. I'm just saying that whatever it takes to actually protect yourself, even if it's just a cloth mask, like even the CDC said, like a bandana over your face, or people make their own cloth masks. Actually, I wanted to show you. My friend actually gave me this cloth mask. Just really cute. I don't know if it's a cat or a bear with hearts. Like, this is sufficient enough. It's not a surgical mask. It's not a 95 mask. It does cover the mouth. So that is what we need to protect ourselves.
As long as it's doing the job. But yeah, okay. Can you give me a little rundown of your daily job at the hospital nowadays?
I wish I could tell you that there's a system now on how to treat these COVID patients, like what we did during my cardiac floor. Like, just as a backtrack, for cardiac patients, open heart patients, usually there's a timeline of how they heal. Let's say on day 1, you do this, day 2, they get out of their chest, expected to do this, and the care remains same for this and that, even for cath lab and EP patients. But with COVID-19 patients, the virus and the infection presents so differently in each person. It presents so differently, so there is not an expected course of treatment for these patients, especially depending on the type of patient you have. Is the patient vented? Is the patient up and running in the room? Is the patient always deoxygenated? Is the patient confused? So there is a system, or if there is a rundown as to how to care for the COVID patient. They're really not the one thing. There is not the one universal thing, except for the fact that one of the main concerns for COVID patients is their oxygen status. So actually, most of the shift is just trying to keep the patient in them breathing and maintain their oxygen.
So you're dealing with COVID-19 positive tested patients. How jam-packed is the hospital right now?
Right now, glad to say that we are seeing a light at the end of the tunnel. Our hospital was jam-packed, like the beginning of March and of February. It was really, really, really crowded. Now we're seeing a lot of discharges. I believe the other night we marked our 500 discharge from the hospital. So that is really, really great news. When I was at work last night, we actually had a lot of empty beds compared to how it was for a few weeks. Okay. So that is a really great thing. Especially, they are saying that the rates of incidents and positive tested patients are decreasing in New York daily. Even though the rates of death and critical patients are increasing. But prior to all of this good news, it was so jam-packed to the point that I believe in some hospitals they were closing up the lobbies just to make extra space for beds, because there were no more or empty beds themselves. Actually, there are even our own. When COVID was really at its peak here in New York, where people were waiting for a room in the hospital floors, and there was none because it was so packed with people dying in the emergency room because of respiratory failure. So it was really, really bad. It was really, really busy. It a shortage of staff. It was rough weeks, rough busy weeks.
So did the hospital ever get to like max capacity, like where you guys couldn't hold any more patients, or you guys never had to do anything? Like if a patient came in but you guys were at max capacity, you guys couldn't like tell them, oh, you guys have to go to a different hospital or anything like that, right? You guys accepted every patient that tests positive.
hmm So initially, how most of the COVID floors started out is we take patients who were tested. It started with just patients who were tested because there are two types. It's either you're positive or you're a PUI, meaning patient under investigation. It's the patients who have been having symptoms,
Mm.
were tested, but we don't have the result yet. So what happens with that is they're set in a different room in a different area in the hospital, and then we wait until their test results come out. If they're negative, they are sent to a clean floor. So there's at least 1 to 2 clean floors in the hospitals, just so we can house patients who are not positive and who actually still need medical help and medical treatment. It just seems that when COVID was at its peak, it's as if there's no other diseases in the world, which is not true. There are people who are still sick of other things who are not COVID positive, so they were sent to non-COVID units.
What are the symptoms of COVID-19?
Mhm. So COVID-19 is caused by a virus infection. So as an infection, it usually presents with a fever. So that's 100.4 degrees Fahrenheit or higher. But when it was at the peak, we were treating even patients with just a low-grade fever, even those at 99 degrees Fahrenheit, just to be sure.
Yeah.
And because it does deal with respiratory infection, most of the symptoms of COVID-2019 is respiratory wise. For example, shortness of breath or a non-productive cough, which means people are coughing, but there's really no phlegm coming out, and they just get tired of coughing. And then we do get patients who are feeling malaise or just general weakness in the body or sore throat, anything that deals with the respiratory tract. And also a new symptom of those who have been feeling loss of taste and smell, which also is in direct correlation to the respiratory tract. So those are the general symptoms of COVID-2019. But when it does deal with shortness of breath or just mass deoxygenation in the body, we see patients with cyanosis. It's when the body is so deprived of oxygen that the body loses its color. You see people with blue lips or blue fingers, stuff like that.
Yeah, that's kind of crazy and scary. Yeah, I did a podcast on another guest 2 3 weeks ago, Doris. She was she tested positive for coronavirus COVID-19, and it was a weird process. She went through a lot of things that you have talked about, but at the same time, they sent her home and just had her, what was it? Is it called quarantine, or was it the lockdown, where she had to stay in her room and couldn't interact with any of her housemates? But that was their way of treating her. And what I thought is, if you had COVID-19, is like you're staying in the hospital until it's treated. Do you guys have patients that you guys send home to be treated at home, or everyone that's test positive, you make sure they stay in the hospital until they're finished, like no more COVID-19?
Mm-hmm. Well, that's a hard thing because there are people who can just stay home and then they heal on its own. So I think it's a cellular level of what the coronavirus really is. It's a virus. So a virus is not really a living thing. It's not like a bacteria that you can kill with antibiotics or whatnot. A virus is basically just a DNA coded in a protein case, and they are only active where they're inside a living host, like a human being. And then it just dies off on its own in its own time. The reason for a quarantine, for a 2-week quarantine for most people, is that most of viruses, they shed and they get rid of their protein cases and they stop their replication after 2 weeks. You can't really treat a virus. Even, for example, viruses like HIV, there is really no cure for it because it's not really a living thing. It's just technically a DNA in the protein case, and then it goes away on its own. So the point of the 2-week quarantine for those who are having symptoms or tested positive, and even those who are not getting treatment, is that is just the right amount of time for the virus to go off on on its own in your own body, and you are quarantined, so you're not spreading the virus during that period. So actually, some of my classmates who graduated with me were working in COVID units. They actually got symptoms and tested positive, and some of them, got and they're 22 to 23 years old with no underlying medical history. So again, it is a lie, and it is not true that it's only the very, very old and the very, very sick who can get the virus. My peers who are my age with no underlying medical history have gotten the virus as well, tested positive as well, couldn't breathe. So that's why it's so important to social distance and to protect ourselves and protect the people around us. So yes, that's how most people who stay at home in quarantine, they usually just resolve on their own, unless, again, the virus presents so differently in every person, unless you do need medical treatment. Usually the gold parameter is that if you're feeling short of breath, it is recommended to get medical emergency help and medical treatment.
Yeah, because you can't really treat them from home, right? Because they need that oxygen.
Yeah.
Okay, so in terms, it wasn't because she had no mild case of COVID that's why they sent her home. It has nothing to do with that. It's just that she didn't really have the shortness of breath like that, and she was able to go home. And thankfully, she's one of the recovered patients.
Yes, I'm glad to hear that. And also, it comes to the point that even if you're not feeling like grave symptoms, it is true that people can spread the virus pre-symptomatically and asymptomatically, which means that we've been getting reported people who spread the virus even before they got symptoms, or even if they don't have symptoms. That's why it is so important to social distance. Let's just say the people in the beaches a few days ago, how many of those people who are unmasked actually had the virus and they didn't know it and are spreading it to the rest of the people, thousands of people there? That's why it's so important to stay home, because even for yourself, you don't know if you have it. And what if you don't have symptoms yet? You know what I mean? That's why it's so important to social distance. It's not just a term, a blanket term that we say. We've actually seen the effects of COVID. Actually, my patient yesterday, so sad, but he has no in a home with 2 people who were positive. And even though there were rooms apart, he still got it and never left the house. How much more if you're in a crowded and saturated place and unmasked people are all over this? So that's where the issue comes in.
Oh yeah, but to put on some also it's not rocket science that it's like if one could spread to how many people and then they see other people, no one's following the rules, it's gonna spread everywhere. It's not no rocket science. It's like people should know how lethal this can be and how it spreads so easily. After seeing a COVID patient, do you have to how do you go to see another COVID patient? Do you have to do any follow-up procedure, or you just go walk in from one patient to the next patient?
Yeah, so when the PUI, so the patient investigations, it was more of a mixed tour. So everyone was tested. So it's either they were positive or the rest, we were waiting for the results. So generally, the rule is that if it's from COVID positive to COVID positive, we just go in with the same gown and we just change our gloves. But if we're going from a COVID positive patient to a PUI, we change everything. But then we realized, even if we are changing gowns, just the whole atmosphere of the floor, it's probably so heavily infected with COVID that we gotta get rid of these patients who are not positive yet or not positive at all. So that's why we made our floor into 100% COVID positive patients. Because the longer these non-positive COVID patients are there, especially because they have other underlying medical conditions, they are more exposed to the virus. So now it's just pure COVID positive patients, and we generally, especially in emergencies, we just use the same gown, and to also conserve the protective equipment that we have.
Yeah. Okay. How are you feeling? How did you feel when you had to deal with your first COVID-19 patient?
Very hard question, to be honest. Like, how do you feel? I think it was it's like a roller coaster emotions. Of course, you are there to treat and care for the patient. At the back of your mind, there's that fear, there's that worry that, oh my gosh, I might contract the virus from this patient. Especially during that time, we didn't really have a definite setup of what a protective equipment against COVID-19 should be. But at the same time, of course, you have that empathy, and you have that goal to care and treat this patient. So I remember my very, very first COVID patient. This male patient was in his 50s, and he came in no significant medical history, actually. And he actually didn't want me to go inside this room too much. He was like, no, I don't want you to get infected. So it was very heartbreaking for me, actually. Most of the patients that I had in my cardiac floor, they actually like nurses and other staff coming in to check in on them. Of course, the hospital can get really, really lonely. You're just there, you're out of the house, it's a different environment, and they want people to talk to. Usually I can sit down with my patients prior to COVID and have a conversation with them, get to know them, build some relationship and trust. But of course, in the COVID-19 pandemic, you also want to protect yourself. So you don't really stay in the patient's room too much unless you have to be there, so you won't be saturated with the virus. And the patients themselves understand of all the fear that goes alongside and along with this virus. So I remember that patient said, please don't come in, I want you to protect yourself, which is a very, very heartbreaking thing to hear. So that was my very, very first COVID patient. Cannot forget it.
I'm not sure if you're able to talk about your experience, but how was it emotionally, like, for you seeing your patients like pass away and stuff due to this virus?
Yeah, well, that's a very sensitive topic, especially when it comes to healthcare. It's supposedly something that we get used to. That's of course here and there, even of course prior to COVID, even a cardiac floor, people die of heart attacks or whatnot. But COVID 2019 really escalated the amounts of deaths that we see per day. There's nights we see between 4 to 7 deaths per night. And of course, it's a very, very, very hard thing.
Wow.
There are some memorable deaths, as it sounds. It's usually just because of the situation that the patient was in. I believe a few weeks ago, around 2 weeks ago, I had a patient who was 90 years old and was very just lethargic, already just in the bed, of course, COVID positive. Oxygen was not going well anymore, and blood pressure was very down, like 50/20. And I have never seen a blood pressure like that ever in my life. It's basically the heart is giving up already at this point. And we had a Zoom call with the son asking if can we make your mother DNR DNI. So DNR DNI means do not resuscitate or do not intubate. It's a legal order where a family member or the patient, if they cannot make a decision, signs and agrees to the fact that if a patient's heart stops and their breathing stops, that's it, we'll let them be. And we don't do anything. We don't do any more CPR. We don't intubate them or whatnot. And the son was very adamant that he didn't want his mom to be DNR DNI. So we had to do the full code, the whole CPR and intubation process. And of course, we were trying to convince him that your mom is suffering or whatnot. It would be the best for her, but he was very adamant. It's very understandable. Of course, especially death of a loved one, is a very sensitive topic. I think when it comes to that point, we never want to believe that the person who we love or we hold near and close by and dearly is leaving us very soon. So the patient stopped breathing and stopped beating the heart, and we had the whole process of compressions and intubation, which I believe she didn't need to go through all of that. But of course, this is where deaths become very sensitive. It's not just legal matters, it's not just emotional matters or physical medical matters. It's a very complex thing, especially when it comes to loved ones. And that's the hardest part, I believe, with COVID-19, our critical patients who have been dying, is just seeing these family members cry. Because of course we can have visitors in the unit. We call them through Zoom or through FaceTime, sometimes with our own cell phones if it's very emergent, if it's such an urgent matter. Of course, if they're dying, is emergency. And of course, we see family members crying on the phone through FaceTime or through Zoom, begging their parents or their loved ones to stay, to wait for them until they can see them again, and saying sorry that they couldn't be there, or all of those things. It's just very, very, very heavy to see these things. And last night, actually, I received a call from a patient's daughter who was begging me on the phone, saying, please keep her alive just even one more day. And it's one of the most heartbreaking things I have ever heard. We try our best to prolong these patients' lives. We try our best to, with all of our measures, to keep them breathing, but there are, deaths do happen. There are some people that cannot be saved for sure, and that's where the hard part is. We have patients who are alone in the hospital again because they can't have others who hold our hands and say that they are tired. I remember just one last story is one of my patients, she was definitely out of breath and her oxygen was very low. And I went to her room and she held my hand and I said, are you short of breath? And she shook her head. I said, are you sleepy? And she shook her head. And I know she's tired. So I said, are you tired? And she nodded her head because she couldn't talk because she was intubated. And tears rolled down her eyes. And then after some time, she passed away all alone. So we have patients who passed away without their family members on the phone or next to them, but are holding our hands. They die holding our hands. So it's a very personal and sensitive time. And it's very sad, but this is how serious the virus really is. That's why it's so important that we all take our precautionary measures. Because it's sad and as scary it is to say, it could be our family members in that bed. It could be us in that bed. So.
Yeah, if people keep going on and abusing it. It could be their family member. You're just making the chances higher for your family also by being selfish. From experience, how long does it take normally for a COVID-19 patient to recover, or the first sign of recoverment?
Well, again, everyone is different. The virus presents differently in other people. I see patients who are out after 1 or 2 weeks, and that was it. They get their regimen, they feel much better, and they are ready to go home. But we have patients who've been with us for the past 2 months. So and there's patients, of course, who pass in their bed. So if there is a timeline as to when a patient is better, I cannot really say that in a definite. Yeah, everyone is really different. And again, this virus is so unpredictable. It's so scary. It's scary. That's the point blank. It's scary.
I didn't know that patients would still be on it for even after 2 months. I'm surprised with that.
Yeah,
part.
actually,
I never heard of that.
Yeah, actually, earlier last night at work, I looked at the monitors. I was like, this patient is still here. and you get surprised. My expectation was I would see a different name every single day given the increase in incidence rates,
Mhm.
but I see patients who have been here for the past months, the same exact name, the same exact patient, and it's really sad that for some or for many, they will um, expire in the same bed that they are in.
Yeah. Uh, yeah. I don't know what to say about that, but what are some things people can do to avoid COVID-19?
Yeah, I think really prevention is key. Once you have it, we take it from there. But while you are feeling okay and while you do not have it, I think this is the prime moment to really take care of yourselves and the people around you. Of course, hand washing is the key. Hand washing, at least 20 seconds in water and soap. If you have no access to water or soap, a hand sanitizer with at least 60% alcohol is fine, unless your hands are visibly soiled. Not touching your eyes, your nose, your mouth where the virus can enter, especially the droplets that remain in your hands if you touch a surface. That's why it's also so important to disinfect surfaces with, either bleach or those with alcohol, again, with higher than 70% for disinfectants. The surfaces, the most commonly used spaces, doorknobs or even desks, chairs, stuff like that. Try to avoid touching surfaces when you're in public or outside areas. When you cough or when you sneeze and the tissue paper, you throw away that tissue paper. And I think the most important thing is that you avoid people who are sick. Again, there is pre-symptomatic and asymptomatic transmission. That's why the people you are standing next to, you don't know if they have it or not. That's why it's so important to maintain 6 feet at least 6 feet distance from another person. That's why social distancing, again, it's not just rocket science, it's not just a term, it's actually something that we really have to take into very serious matter. Think about it. You go outside, you don't know what you get outside, then you bring it back home, especially if you're living with loved ones. You're putting not just yourself at risk, but everyone else around you.
Yeah, that's true. What are some things that people can do to ensure, even if they have the coronavirus, that they can beat this virus health wise? Do they have to ensure that being healthy, not just staying in home, but staying in shape, all these things, like your immune system?
Yeah, again, there is no cure to the virus, but of course, as with every different types of infection or diseases or conditions, we can take measures to take care of ourselves and to boost our immune system. With infections, the immune system that's really targeted. I cannot say that, vitamin C will help, vitamin D will help, taking supplements would help, because generally it will not beat or cure or kill the virus, but it does help support your immune system. And I think it's very important to support our immune system, especially getting away from the risk of other conditions in addition to the virus itself. Yes, staying fit, staying healthy is very important. We're starting to see that COVID-19, its complications may not just be respiratory, but it's actually due to inflammation itself. And inflammation can be caused by so many things. It can be caused by too much of sugar, too much of fat, too much of salt. So, general guidelines of watching of what we eat, if we can eat healthy, and in moderation of the things that are processed foods or foods that are high in glycemic index or in sugar. Taking vitamin C supplements, it's not bad at all. Vitamin C is an antioxidant. It does help boost the immune system by targeting and fighting free radicals and toxins in the body. So just general well-being practices really do help. It is not a cure. It will not treat the virus, but it does boost the rest of the body. So why not, right? We do all that we can to stay healthy.
Because I'm eating a lot of vitamin C or oranges and everything.
Yes. Yeah.
So, and I'm constantly jogging and stuff, but I wasn't sure if it was helping, but I was just doing my part.
Yeah, it does help.
But okay, so all right, that's good to know. So everyone, don't just sit in your bed. I know we're in lockdown, just still gotta stay healthy. So I found you on like the group Asian Hustle Network, right? Was it? Okay, yeah, I seen your video, the one you posted. So you take 2 hours you leave the house 2 hours before you get to work. You have an hour. It takes you an hour to get to work, and then you work. What was it, like a 12-hour shift? And then you take another 45 minutes to an hour to get home. So it's like that's like 15 hours of your life every day. It's like, how are you managing them? How are you managing that, like the stress level and your own you time?
Yeah.
How are you managing all this?
Yeah, it's hard, honestly. It really is. But it's just me personally that I leave 2 hours before work. Especially when it comes to COVID, it can get really stressful, and I really want that quiet time right before work. I'm really the type of person who don't like being stressed out too much by things that I can control. The things I can't control are like subway delays or emergencies, of course. So it's just a personal thing of mine to get to work really early. At least I can sit down in our staff lounge and just take in for the day and just boost myself up, saying, oh, we can get through this night. But when it comes to me time, I think it's really a personal effort to do so. Especially I work night shift. So when I get home, it's around, let's say, 8 or 9 a.m. Then I'll be sleeping and I'll wake up, let's say, 5 or 6 p.m. My day is already done. So unlike other people who have already gone out through their days or gone out with friends or whatnot, I will be sleeping. And for me, because that day is already over, personally, my day off doesn't start until the next day after, because I need all that time to relax, because my sleep schedule is completely different given that I'm a night shift. But there are times where I really have to force myself, saying, oh, I gotta wake up earlier just so that I can actually go out and do something and have some time to actually relax and unwind from work. Because work can really get stressful. 12 hours are the shifts, but with COVID going on, there's times where I where I don't end some shifts until like 8 o'clock or 8:30 p.m., especially with all the charting and the other extra things that we have to do.
What's one thing you want to do once COVID-19's over, or when it's like near the end?
I don't see an end just yet, but when it does come and we're able to go out again, oh my gosh, I'm going to go to every restaurant and eat my stomach out. I usually go to K-Town here since it's in the city and it's quite close to my house, so it's like 15 to 30 minutes away by train depending on the traffic. And most of the times me and my friends just sit there and just eat, and that's what I've been missing, actually, spending time, of course, with my friends, with my loved ones. And I was actually at K-Town here in New York the night the lockdown started, and it was so empty. It was a ghost town. I was so surprised. I have never seen the city, even until now, as empty as it is ever before. So we know that something is wrong. Even though there's some people not taking it seriously, there is something wrong. But that is what I'm gonna do. I don't even care. I will stuff my mouth with all the food that I can find outside after all of this is over.
Yeah, that makes sense. Yeah, I've been to New York 3 times, If I come back the 4th time, I gotta treat you out to eat, like, as an appreciation of what you're doing, like,
thank you.
I gotta do that.
I'm excited to meet you too.
Or to eat. Yeah, one of these days, or whenever you're in Cali, just let me know. But yeah, let everyone know where they can find your social media, your YouTube, your Instagram, Facebook, whatever it is.
Sure. Hi guys. I hope you got to like our conversation today. It was such a meaningful conversation It's such an honor to be able to share news and information about this topic that's very harsh but very dear to my heart right now. If you're willing, you can find me on social media. It's Kristian Franz. It's KristianFranz on Instagram. If you want to see me post some stuff or whatnot. But I also have my YouTube channel. It's Kristian Franz, youtube.com/Kristian Franz with the same spelling, where I post videos mostly of my nursing journey, and especially with COVID nowadays, it's kind of hard to post content, especially with how busy things are, but I will try my best. And thank you for chiming in with us tonight.
Yeah, thank you, Kristian. If you guys don't want to miss his journey with COVID-19 as a nurse, you better hit that subscribe button for him. Yeah, alright guys, see ya.